We're really excited about the Ocrevus data that we're showing here at AEN. The story actually goes all the way back to October 2015 at ECTRIMS when we presented our first data at Barcelona at the ECTRIMS, where we unblinded the trials. We had trials called OPERA, which is in relapse CMS, and the Oratorio PPMS. At that Congress, we showcased the top-line data for both of those trials that were positive. All three trials, 2 trials in OPERA and 1 trial in Oratorio. The story now has evolved over the last, since then, to where we follow these patients now for a total of 4 years. So in the OPERA trial, patients are started on Ocrelizumab, now have been followed for a total of 4 years, because there are 2 years in studies and 2 years in the open label. And we also have patients that switched. They were on interferon beta, because the study compared Ocrelizumab to interferon beta, and now they have been on Ocrevus for the last 2 years. So we have a total of 4-year data in these patients. And we see very good sustained efficacy on 3 measures. Relapse rates remain low, MRI lesions in the brain remain low, and disability progression remains very low in these patients. And not only that, the patients that switch, we see a rapid reduction in relapses as well as the MRI lesions, and then the disability progression also remains low. The patients that started on Ocrevus in the beginning have a lower disability progression rate than patients that switch, which indicates that you really want to treat patients as early as possible. So that's one piece of data that we're showcasing here. The other piece is cognition. So now for the first time we're showing cognition data from our studies. We used a measure called SDMT, the Single Digit Modality Test. And we see that in the studies, the OPERA studies, the relapse and risk studies, we see a decrease in progression of cognition by about 40% when compared to the Ocrevus treated to the interferon beta treated patients. Not only that, if you look at a subgroup of our patients from the study, those patients actually improve in cognition. Patients that were at baseline worse off in terms of disability and cognition, those patients seem to improve their measure of cognition. So that's the second piece. And the third and last piece that we're highlighting here is a biomarker. The field has been looking for a biomarker to look for early signs of progression in patients for a long, long time. And we're showing data here on a biomarker called NFL, neurofilament light chain, for spinal fluid. And there we see with a single Ocrevus dose, at 12 weeks about 25% reduction in NFL, and at 24 weeks about 50% reduction in NFL. NFL is a marker of neurons, degenerating neurons that are dying off in the brain. So this is an indicator that we're reducing that degeneration of neurons. Of course, this is important for patients because that can indicate a decline in their ability to, their disability and their cognitive abilities of these patients.